If you have been locked in the home due to coronavirus outbreak and playing video games 24/7, you might have thumb pain to the point that it's even hurtful to raise your thumb good luck to people. You might have the Quervain's tenosynovitis. Wait, what is it? Let's talk more about it. Such a classy name. Ooh, the Quervain tenosynovitis. Très bien. Oh, my thumb hurt. The Quervain's tendinopathy or tenosynovitis is a condition that's very common. In fact, it has a lot of other names as well. They also call it gamer's thumb or texting thumb or BlackBerry thumb. But today you might as well call it iPhone thumb, right? It has a lot of other crazy names too, like washerwoman's thumb. It's a little sexist, right? Mother's wrist or mommy thumb. It mostly happens in people who use their hands and their wrists more frequently. It's very common in moms of newborns because they use their wrist a lot to carry the baby and to feed them and to just hold them with one hand and do a lot of other things with the other hand. Now, why is it called the Quervain's, this classy, nice, fancy French name? Well, it was first described by Fritz de Quervain, who is a Swiss surgeon who specializes in thyroid diseases. What did he have to do with wrist? I don't know. Back in time, it was very common for doctors and scientists to discover a disease and then put their name on it, right? I wish there was a disease that I could find and put my name on it. Now, the Quervain's tendinopathy, it's the inflammation of the tendons that attach muscles in your forearm to your thumb. If you don't know what a tendons are tissue bands that are connecting muscles to the bones. Now, when we overuse our wrist or our thumb to text or play games or to feed the baby or whatnot, a tendon in the thumb gets inflamed and it gets painful over time. What are the symptoms of this condition? As I said, you're gonna have a lot of pain in your thumb and in your wrist. You're gonna have a lot of pain gripping objects, and also you may see some swelling around your wrist and your thumb. There's also a test called Finkelstein test. Again, another scientist guy who puts his name on a test. In this test, if you make a fist like this, and then you bend your wrist like this, if you feel a lot of pain here, then we call it a positive Finkelstein test, which is a clinical indicator of the Quervain's tendinopathy. Will you need any blood tests or imaging tests? Probably not. So stop bugging your doctor to get an X-ray or MRI of your wrist. Now, how is this disease treated? Basically, the reason you're watching this video. The most important treatment is to rest your thumb. Basically, less gaming or less texting or less, well, you can't hold your baby less, so good luck with that. There's a splint that we call spica splint that we use to immobilize the thumb to give it more rest. Also, you can use ice packs. Sometimes it gives you relief. Medication-wise, you can use anti-inflammatory drugs like NSAIDs, ibuprofen, naproxen, Advil, Aleve, and so forth. Just make sure you don't have any underlying contraindication to take NSAIDs, like GI problems, ulcers in your stomach, or any bleeding, or if you're on any other blood thinners or aspirin, you should be careful and consult with your doctor before taking NSAIDs. If these measures didn't work and you still have a lot of pain in your wrist, then you can go to your orthopedic doctor and talk to them about possible injection. Ooh, that is painful, man. Sometimes you don't have any other choice. So what they do is they inject steroids into your wrist. Ooh, nice watch. And sometimes it helps. Now, if this doesn't help too, then the other option is surgery, which is... Now, after your symptoms have improved, there are exercises that you can do to strengthen your muscles and prevent further episodes of the Quervain tendinopathy. I will teach you some of these exercises. You want to start with exercises that will stretch your tendon as much as possible, okay? Now, hold your hand like this and start opposing your fingers like this. Alternate them. This will put stretch on your tendon and it will not strain it a lot. Hold your hand like this, swear to God. Bend your pinky and press it down with your thumb, okay? This will put some pressure on your tendon. Now, do these as long as you don't have a lot of pain. If you have a lot of pain, just stop doing that exercise, okay? Now, the other exercise is to put stretch and pressure on your wrist tendons. You can hold your wrist like this, put a little bit of pressure on it, and press as much as you can tolerate. You don't have to have a lot of pain, okay? Don't break your wrist. Also, you can do the reverse move like this. Hold an object, not too heavy, I found this box, and then do this movement a couple of times. Just start with a small object, and then you can increase the weight. Grab a ball, I have a nice ball here. Start squeezing. Sorry, happy ball. Grab a rubber band and put your fingers inside and start opening it up. You can always see a professional physical therapist for other movements and exercises that will help prevent further episodes of the Quervain tenosynovitis. Thank you guys for watching. If you have any questions, comment below, and if you want me to talk about any other medical condition, please let me know. I'll do it ASAP. If you like this video, tell your friends, share it, subscribe to our channel, but if you don't like it, keep it to yourself. I'm watching you.